So, welcome everybody back. This is the second international session. We had already our first session opened by our Excellency, the Minister of Science, Manuel Leitor. And we had many patient organizations on board. We were very happy to see that. And we had 4 organizations talking about best practice examples, how they got engaged and involved in research. It was not only about cancer, there were also other diseases, because our new strategies we are trying to develop further, also perfectly adaptable to other diseases. But all this stuff started with a declaration that was signed by the trio of the ministers of science from Germany, Portugal, and Slovenia last year during the German presidency on a high-level conference. And I'm going to share my screen for a small presentation. So this declaration, and it's only one side you can see, it was full of references regarding the extreme importance to involve patients in cancer research, because who else could identify better the real needs than the patients themselves, of course. So that was a very important kick-off, this compromise of the 3 ministers of science that signed the importance of the involvement of patients in cancer research. As a consequence of this declaration, the German ministry organized very quickly a focus group of 3 patient representatives and 3 German investigators. And it was Bettina Rill, who is present here in the session, it was Jan Geisler, it was myself, and then 3 investigators of Germany, as I told you. And those initial recommendations were given to a wider audience in December 2020. We did a European workshop with more than 100 relevant stakeholders from all over Europe. We had all the umbrella organizations of patient organizations with us on board. We had people from industry, from science, from political background. And then in May, we had in Portugal a high-level conference where the Porto Declaration on Cancer Research also gave importance to the involvement of patients in research. Then in consequence of this German kick-off of this important work to involve actively patients in research, I got together with our team in Portugal, André Valente from Fundação Champalimau, Constanza Roquette from the Nova Business Economics, and also people from our public School of Health, and more participation, better health. So it was a nice group that we aimed to continue this very important work that was kicked off by Germany in 2020. And we did a questionnaire because we needed to get an idea of the state of art of Portuguese patient associations, and those only cancer patient associations. And we had around, I think, 26 organizations responding. And the result was really kind of surprising, because 76% of our patient organizations were not involved yet in cancer research. And that shows us that we have a lot to do. We need to organize ourselves on national level. We need to centralize information and contacts. We need to know where can we find our partners that we need for our project. And I think we will learn very, very important stuff with our speakers. We are happy to greet in this session. I'm talking about Jan Geisler, the chair of the work group of the European Cancer Patient Advocacy Networks WeCan, and Bettina Riddle is the founder of Melanoma Patient Network Europe and member of the Horizon Europe Cancer Mission Board. Nothing less, nothing more. And also David Krivec, he is the Secretary General of Alzheimer's Slovenia. And during this session, a roadmap for patient participation in research in Europe will also be discussed with the presence of participants and officials from Germany, Portugal, and Slovenia, the countries that currently compose the trio presidency of the Council of the EU. Dr. Matthias von Witsch from the Federal Ministry of Education and Research, Germany, will make concluding statements to this global session. Bettina, the stage is yours. Welcome and thank you for being with us.
Thank you so much for the kind introduction, and I feel very honored to be here today with you and talk about a topic that is very, very close to my heart, as anyone who knows me knows, and that's exactly the reason why I will set my timer now, because otherwise I will could talk about this for hours. So I entitled my talk From Good to Great, why patients should actually be involved in research. And in the next 15 minutes, I would like to give you a little bit of flavor of why I believe that this is so important. So what I did actually last night was that I posted on my Twitter account why one should actually involve patients in research. And these are two spontaneous responses that I just snapshotted. You'll find this all on Twitter as well. But to give you a flavor, what researchers think of why patients should be involved. One would be, one said, it keeps it real. It promotes transparency. The other, and he also highlighted that especially for basic research, it reminds us, as in researchers, why science actually matters. Another response was, if embedded into a research initiative, advocates can make a powerful advocate for the research itself. So not just for patients, but for the research itself. I would like to highlight here that this is the perspective of why researchers want to involve patients. However, I would like to invite you to now switch perspective with me. I've always loved these glasses that change your perspective when you look through them, that the world looks differently. And I believe that this is exactly what we as patient advocates should be doing. So I invite you to follow me on to the real question. Why should we as patients, or rather as patient advocates, get involved in research? Why should we bother? And why is this so important? Now, before I would like to go a little bit into what I consider actually our strength, often our community thinks just about ourselves as in we are lacking this, we are not educated to that. And I think that's already one of the issues. A little bit about myself and how I get to stand here. So by origin, I'm German. I have studied medicine in Germany and France. I spent 2 years of my medical training in France, and then moved on to do a PhD in basic science at the University College London in the UK. And I worked in developmental biology. So that's what the topic of my PhD was. And after that, I really enjoyed research, and I got an offer for a postdoc position, which got me to move to Sweden, where I still live. And I worked on the interface of evolution and development for a couple of years. I ended up in patient advocacy, as unfortunately in 2011, my husband was diagnosed with a stage 4 melanoma and unfortunately died of it in less than a year. And at the time, that was the average survivor that you could find in our disease. And that was probably also one of the reasons because for there not being a European organization for melanoma. And that's how I started one. And I guess with that background, it's not surprising that I was always particularly interested in research, and that was also the approach that I took to advocacy. It was also a time when new therapies are coming through, and we thankfully moved from a survival of about 5% at 5 years to one that is above 50% or around 50% at 5 years. And that happened in a very short amount of time. So we were in a way privileged to witness that progress in science. And so we would be a community, a cancer patient community that very much appreciates what science can do for us because we have watched it with our own eyes. It is our own people who now survive. People who diagnosed today have a very different life expectation than those who were diagnosed just 10 years ago. So in this, I think in this field of appreciation and on one side, the need on the other, and then my background, I think that kind of triangulates why I've thought so much about research. Now, when I look at us, and what my kind of personal experience has brought me to was that I was medically trained, I was research trained. However, when my husband was the patient, I realized how little I had understood about how research works and what impact it has, and where the details are that truly, really matter when you are the patient, and what type of outcomes we need as patients, and what type of structures drive the outcomes that we need as patients. And as always, the devil is in the detail. And I do believe that, I think everyone would say, unless you're born with a condition, if you're diagnosed with a cancer or another serious life-altering condition, what everyone says is, I had no idea how it would be before being diagnosed. That is such a life-altering event. I always compare it to having children. Before we had our firstborn, we probably went around giving advice to others what they should be doing or not be doing with their kids. But once you have your first child, you realize how limited your understanding was. And a cancer diagnosis is obviously nothing positive, but it has the same quality in altering your perception, your priorities, what matters, what doesn't matter. How, on that side, can we expect others who haven't been there to understand what we are going through if we don't tell them? So I believe with this privilege, and that I don't misunderstand me, I don't think there's anything in cancer that is a privilege. But in terms of perspective, we are the ones who have it. No one else can have it. We cannot expect others to have that perspective. So it is our responsibility to share it and to make it accessible, because we cannot hold others accountable for their work and say, you're not delivering what we need if we first didn't tell them what we needed. So I believe that we are in this unique position to help make research better. And as I already alluded to, we're the ones who know what it is like, but we are also the ultimate ones with what is called skin in the game. We win if there's progress, good results. It is our people who live longer, better. We also lose if things go wrong. We are the ultimate stakeholder group with most to win and most to lose. There's a lot that is said to be in patients' best interest. If you look at it, a lot of it is not. It's on us to speak up and say, well, that's sad, but that's not true. If we don't do it, no one will do it. The next thing is equally important. We care about the problem, also because it's so close to us, because it hits us directly. Often research is driven by love for the solution. My favorite model system, this is what we're doing here. That's falling in love with the solution, not the problem. We are the ones who can hold a system accountable to go looking for that solution that really solves the problem, not one that is convenient, cost-effective, just happens to sit in the shelf. You would be surprised how much vested interest is inherent in our current research ecosystem. It is the need to publish, it is the need to get in grants for the researcher, it is the need to be seeing funding research for the funders. If you look in how research funds are distributed, how projects are chosen, there's a lot of room for improvement. And who would be more motivated than populations like us? Also, something what people often consider a disadvantage, and I don't agree with that actually, is that in a patient community, we are not unified by a university course that we might have taken together. We're unified by condition, by a diagnosis. But that means that our networks are diverse. We have any walk of life. We have people with very diverse professional backgrounds. We have a diversity in geography. We are united in one aspect. That's why we talk to each other. That's why we trust each other. That's why we know each other. But we have very different expertise that we can contribute to solving a problem. So instead of saying, oh, we lack this, I think we have to start looking better at what we have and how to leverage our knowledge and our expertise. To give you a bit of a more concrete example, I have an example a little bit further, what this can actually look like to help our communities thrive, but also help us contribute to research, an outside perspective that no one else would be able to provide. And then last but not least, I think we all fall into the category of thrifty. I mean, I have never seen a rich patient organization. We know how to make things happen on a low or on no budget. We are very good at getting things moving, while others would just give up. There's always something that a patient organization finds to do and an angle to take. And that we should take as an asset and something to take forward, also in a research setting, because that is a world just like any other, and it does not differ in that aspect in Solvay. So this to give you an example of what we have lifted from one of our network members who happens to teach startups in an accelerator in Amsterdam. This is a technique that businesses and startups use to map customer pathways. We've adopted it to map a patient pathway. And this has been instrumental and really, really helpful to get at a systematic understanding of our problem. I could just talk a full day alone about how to think about the problems that we try with tackling in research, because I believe that that is a place where we often go wrong, because we just focus on what I call our favorite problem. I would just like to leave you at this point with an analogy how to think about what type of research needs we have. I don't think it is a correct way to look at any disease and say this is our number one priority. That is hardly ever the case, because our diseases span very diverse stages, different population, different subtypes, and you start pitching population against each other. So I don't believe that's the right way to take. I like to compare it to just imagine you move into a new unfurnished house. Everyone moving into that situation knows that you will need to buy a bed because you need a place to sleep. You will need blinds because otherwise you still won't sleep despite having a bed. You will need a table. You need pans. So you will not just move into a house and say the only thing I need to find is a towel. You will have this set of things that you need, and you will have a preference what to find first, but you always kind of on the back of your mind look out for the other items. And this is how I think about research. Know the issues you want to address and keep an eye out for opportunities that present themselves. Because the last thing you want is being staring at your favorite problem, but have solutions to your problem number 3, 5, and 6 walking past your nose and missing the opportunity. So I think there is something for us to educate ourselves about thinking about problems, having a good understanding of them, but also thinking about what I call the solution space. Now, very briefly, because I'm mindful of time, the type of interaction. We all have people with whom we connect and others with whom we connect less. There are different types of interactions that we also see in the research ecosystem. And I've just kind of tongue-in-cheek, and I don't know what I did now, but apparently it's annotating, is one that I call meet and greet, where there's a superficial interaction. I think that's a historic approach where we have the omniscient researcher talking about the progress and the grateful patients being just grateful that someone actually finally works on the problem. In that scenario, there's no real exchange, no real contribution. There's a slightly better version of it where there's an overlap, where there's a very defined area, often defined by the research site, where they want patient input. This is, however, very susceptible to the fact that it is the researcher defining where they want the input, and that's often not necessarily where the patients would like to give the input. And I apologize for the red nice scribble on top, but I don't think it's actually me doing that. So the point in there is, Yes, there is a value in having a predefined contribution, but think about who defines the shape of that contribution. And of course, I have a favorite version of it all, which I call research peers. And this is, in a way, just the model that you will find at the intersection of any type of fields. If you work with a community that is different from your own, where you try to achieve a situation where the mutual understanding of each other's situation is so large that you can start making spontaneous suggestions to the other side. For me, ideal looks like when someone comes to me and has a solution to a problem I wasn't aware of I had in the first place. That is the space where I believe we start gaining speed and where real change happens. That is what I would like you to invite to find. Find these people. There are these minds out who want to learn, who are willing to challenge themselves, to challenge the system, who care about real solution. It is about finding the people and the settings in there that will make all the difference. So that, I think, is the ideal we should all be striving for, and discarding less rewarding opportunities, because we only have 24 hours a day. So if you waste your time on something with a low return, you shouldn't be surprised that the outcome is not what it could be. And to conclude, I believe it is time that we as patients and patient advocates take a step back and look at what we want to get out of research. Why do we want to be involved? And where do we want to be involved? How do we want to be involved? What can we contribute, and what has to be in it for us to get engaged? Not all relationships are mutually beneficial. Go for fair deals. Go for deals where everyone wins. Something that feels like a partnership, something that is true. Not any of these tick boxes and surface interactions, which we find so bountiful everywhere where we look. And last but not least, and I know that my colleagues will allude to this, is that education and actually smart tools, a little bit like the customer pathway that I've shown you, are key, because it is not so easy to show up in a research setting. That is my timer that I just tried to kill. Is critical to be able to engage. Also, that is not as hard as it might sound, because just because of the diversity of our communities, we have those people who are often researchers themselves or very close already in our own communities. It is about letting them help everyone to get to the level where this engagement becomes actually possible. Apart from that, there are already fantastic tools. You'll hear a bit from the next speaker about existing tools, how to get started in research. And of course, we're always happy to help anyone else who's interested, because we care about the topic. With that, I would like to thank you. And I've picked actually this slide because I think what we are as patient communities, we are a puzzle piece in this research ecosystem. We are part of the system, whether we want it or not. So far, we've been largely passive, but it's on us in joining these pieces together that we can address something that is a constant criticism of research. The impact is not clear, and the translation into the clinic is not always working. And I believe that we are the ones who can put the pieces together, because we are the missing piece. With that, I would like to thank you for your attention.
Fantastic, Bettina. It was an awesome presentation, and you hit the nerve precisely where we need to work more and better. I don't know who scribbled over your presentation, but it was funny because sometimes normally we have children and house animals around us in the phone conferences, but now somebody decided to design over your presentation. Thank you again, and you are punctual. I appreciate that. The German blood is very strong here. Jan, please, the floor is yours now.
Yeah, thank you so much for inviting me, and thank you for, let's say, bringing the issue of patient engagement in research really on the topic of this meeting. I mean, it's really close to my heart. I was diagnosed about 20 years ago with leukemia. I still have it. It's still active disease. It's still measurable. I've been part of clinical trials. And when I entered the healthcare space as a 20-year-old, I had no idea about medicine. So my background was business. I was working in technology and management. And just suddenly at 28, I didn't know whether I would turn 29. And then actually I went into clinical trial because the outlook was looking better than standard treatment, which would look quite grim. And I was lucky. I mean, you never know, but I was lucky. It has taken me to the year 2001. And over the years, I've developed from, let's say, a patient that wanted to know, a patient that was looking at research, into what Bettina described as a research peer, as somebody who tried to shape the ecosystem and tried to bring people together, because as Bettina said, you cannot shape the ecosystem just as an individual or in your own disease space. You need to work together. You need to work together with researchers. You need to work together with all interested parties. I'm going to talk more about interest in a moment. So what I want to focus on actually is really talking about capacity building and political will, because both are essential ingredients of patient-relevant research, and I'm going to touch base on some of them. Because, I mean, other than 2001, the whole issue about patient centricity is all around us. We hear it every day. If you go to websites of pharmaceutical companies, of governments, of the institutions, of whoever talks about healthcare, they all talk about the patient and say the patient's at the center. And I'm being a bit mean by this photo, because what we often see is that the patient at the center means that he's in everyone's way. So let's talk about the elephant in the room. We actually want to be involved. We want to make sure that research delivers to our needs, but we don't need talk about patient centricity. We need actually real engagement and meaningful engagement, which was clearly outlined by Bettina in previous talk, is that both sides have important competencies and need to bring them in at early stages to make sure research delivers what we as patients need and our families. So what I want to focus on is actually essential ingredients for patient engagement. And I'm going to touch on each of these points: shared purpose and collaborative spirit, engagement frameworks, so the methodologies for patient engagement, the capacity and knowledge to engage, because you can only break the rules if you know them, and you can only engage if you actually know how research works. And then, of course, political will, because frameworks don't change if, let's say, the policy side of things doesn't move alongside of research. So let's talk about shared purpose and collaborative spirit for a moment. I mean, other than 2001, today patients are largely involved in all different kinds of levels. They are part of the competent authorities like EMA. They're talking to policymakers on the EU member state level. They're part of ethics committees. I'm, for example, on the Bavarian one, and review all kinds of studies all the time. We're involved in HTA, and we're involved in clinical research. And of course, I want to talk about research primarily, but still the whole thing doesn't work. And also the public is mentioned, because there's so much talk about guinea pigs and so much reservation in the general population about research that we also need to change the public image. And it doesn't help if we just increase scrutiny all the time. We don't want bad research, but we also don't want that people are totally skeptical about what's going on, because what we need is a solution for the 200 cancers that are out there. And solution means not only long life, but long good life. And that's what we need to work on, and priorities are different. Because priorities are different, I just want to highlight their different interests, because it's very easy to see that as a binary thing, that industry has interests, we should be very careful about them. Everybody in the system has interests. We have interests because we want to live a good life as long as possible. And that's what we as carers strive for. Interests of patient organizations is we need to serve different populations. And even though I've been diagnosed at the 28-year-old, I, as an advocate, need to speak for the whole community, for the 65-year-old, for the people that still want to do family planning, for the people that might have different priorities, for the people that say, I want to live now. The other ones say, I want to live long. So we need to speak for them. Academic research have a lot of interest. They're not doing that for the grade of manhood. They're doing that to work on research questions, on their favorite study design. They want to be in high-tier publications because that's important for their career. And there are many other issues. And also they want to fund the institutions. Physicians want to have best clinical outcomes for their patients, but sometimes they also want to keep a customer. And we see that when we have referral of patients to centers of excellence. Industry, of course, has commercial goals, and it's good like that. They need to have that, but we need to be transparent about that, because they want to develop the products that sell, and we need to discuss with them, but we need to discuss with them in that context, because that's where the resources are for product development. Regulators have interest in safety, efficacy, and market authorization, but they also have, let's say, legal constraints. The payers, they need to serve societal health, cost effectiveness, sustainability of the healthcare system. So it's not just that they do everything for the patient, they have a lot of other objectives too. And of course, digital economy, if we think about apps and people that collect our data, they often start with a mission, then they accumulate data and they're trying to monetize it. And I don't want to blame any one of them. I mean, if you want to hurt cats, move the food. Or if you want to move cats, move the food. So we need to, as patient advocates, always to think, what are the interests and how can we make sure that the interests that everybody's following actually serves patients first and also their interests. And then we can actually develop effective collaboration strategies to move forward. And if we talk about patient engagement, we also need frameworks. Because there needs to be a frame around how we organize ourselves when we collaborate with people. And other than years ago, there are huge amounts of frameworks, and I'm just going to touch some of them, because if people are still asking how should they do that, you can say, well, we know how, but let's do that. And Bettina and me and a couple of others have actually published that roadmap already 4 years ago about the whole clinical trial development process. Or clinical development process. And if you look at all these different bubbles, and I can't go into them, if you want to see them, look at the publication quoted down there. Each of these bubbles are things the HIV community has been doing for 20 years. And we in CML and leukemia, we've been doing this for probably about 10. So it's not a new invention. There are frameworks, there's very clear instructions on what patients can contribute early in the design of studies, during the conduct of studies, and also when it comes to market authorization and post-approval processes. And also, of course, in defined research priorities at the very beginning, there's each of these bullets here are actually clear patient input that the community can contribute to make better research. So the framework is there. And if we talk about, let's say, the companies and also other stakeholders, I mean, there's a patient engagement management suite. It's been years of development that PFMD, the Patient-Focused Medicine Development, a global multi-stakeholder initiative, which I also was involved in co-founding, has built frameworks on all kinds of different questions, book of good practices, fair market value calculator for compensation of patient advocates, legal agreements that we can develop with legal people from 10 companies, patient engagement training, how-to guides. I mean, all is there. If somebody says, I don't know how to do it, your response should be, look there. Instructions are there. The matter is, how do you apply them? But of course, applying is an issue if you don't know how to do it. And I mean, Bettina alluded to the topic of education, and me as the ex-director of EUPADI, everybody who knows me knows I'm really passionate about this, because we need to know the rules to break them, and we need to know how to engage, and knowledge is power. And if you don't know your stuff, there's no shortcut to knowledge, is what Bettina is saying very often. And what we sometimes do as patient advocates, we're just hammering our head against the wall with our opinion, and that's not how it works. Because healthcare is a data-driven business. Healthcare decisions are being made on numbers and on data. And that's where we need to be as advocates too. We need to think about, who do we target? How do we support our opinions with opinions from the community, with data that we generate from our patient organizations? And how do we package it right? Because a politician needs much easier messages, because they need to do it in their work. While if you talk to a scientist, they need a paper with references and sources and methodology. So we need to package it right. That's evidence-based advocacy, and we've been teaching about this for quite a long time. Another thing is the European Patients Academy. That was quite a dream project for us when we started in 2012, because we wanted to make sure that patient advocates can understand how the whole drug development process and all the different issues around that, drug safety and pharmacovigilance process, the whole regulatory process, clinical trials from phase 1 to phase 4, personalized medicine, all the different things actually work. And on the EUPADI website, there's actually a huge toolbox, and there's also a patient expert training course that people can participate in if they actually want to know how the technology behind developing new therapies and assessing them actually works. And it has national platforms in 18 countries and has modules and information, more than 3,000 articles in more than 9 languages. So I can just recommend for anyone who wants to dig it a bit deeper on how research and development works, go to the EUPADI website. And there's more. The disease-specific organizations are also conducting trainings. And I'm just putting a selection of them over here. If you look at the pan-European umbrellas, a lot of them are running education and training for patient advocates to train them not only about research, but also about healthcare systems, about advocacy, about how to run NGOs, how to do fundraising, and all these things. So all these educational activities are there. And if you just look at the We Can Academy, because I'm deeply involved in that, a lot of that can be found openly on the internet, for example, on the We Can Academy website, where you can access most of the resources, whether you're part of We Can or not. And then if somebody says, but all the people in my company don't know how to do that, or the researchers don't do it, cheap excuse, there's a lot of training. EUPADI is doing individual trainings called EUPADI Fundamentals and EUPADI Essentials for healthcare professionals and people in industry. And there's also online training modules developed by Patient-Focused Medicine Development on different levels, level 1, level 2. And I know that a couple of thousand people from different companies have actually performed those trainings because there was pressure bottom down that employees that want to engage with patients actually should go through trainings that they know how to engage properly, instead of just doing trial and error and do the same mistakes that we've all experienced years ago when we didn't have all these frameworks. So there's a fast forward actually to understand the framework of patient engagement and the do's and the don'ts and the quality principles and so on. There's a lot of stuff out there which you can use as patient advocates, which policymakers can use, or which people in academic or industry research can be using. But of course, and Matthias von Witsch is going to speak more about this, it also needs political will. Political will is important because it underlines and supports, because if you want to move the cats, you need to move the food. If you want to move the food, you need to build a political framework also and the legal system. One thing that was amazing during the German presidency is actually that there was a declaration signed by the three research ministers of Slovenia, Portugal, and Germany to unite against cancer and to make cancer research across Europe more effective. So the 3 EU presidencies actually agreed on a plan. And there was a lot in there, a lot of very important stuff, which also aligns with the German National Decade Against Cancer, which I'm deeply involved. But I just want to highlight one section, which also Tamara highlighted in the beginning. It's that the paper explicitly mentions that they want to commit to align cancer research even more closely with the needs of cancer patients and their families, and that patients should be more closely involved in cancer research. This is important. This political message is important, but only, of course, if we now follow up, and following up is actually happening. So we actually had this launch of this paper in October, 13th of October, the declaration. Now at the moment, there's a principles paper which is being drafted, and there's a consultation until 27th of June, so end of this week. And you can see this URL, this address, where you can still go and you can provide your feedback on the principles that have been drafted there. And it's very important, again, because this will go from the Portuguese presidency to the Slovenian presidency to be followed up. There will be a workshop in September, and then the European national stakeholders should actually implement the outcome. But now is the time that we as a patient community can really provide meaningful input on what we really want to see there. So please engage. But the political will needs input. Otherwise, it's again, everything about us without us. And I would say there's open arms so you can engage. So again, just to repeat, there are essential ingredients, and all the essential ingredients for patient-centric research are there. The question is not how, the question is not why. The question today is, why is it not happening? For that, we need shared purpose and collaborative spirit. We need to work together, and we need to all sit around the table, and we shouldn't just do finger pointing what others should do. We should think, what can we do? What can the others do? Where do we come together? Where are the interests, and how do we make sure everyone's interests are in that for the sake of what patients need? We have the frameworks, we have the tools, make use of them. And we need the capacity to engage, and that's a painful process because as a volunteer for patient organizations, of course, you need to take the extra mile after work and so on to really learn and take training, but without knowledge, you can't do it. And then, of course, political will, and we need to keep up the pressure, because in the pandemic, it's so easy to drop what has been accomplished or what is currently underway on EU policy, on national policy, on policy within the trio presidency. It would be so easy to drop that, to excuse that with a pandemic. But we can see at the moment there's a lot of interest by policymakers to keep cancer on the agenda, because the pandemic will go, cancer will stay. And that's why we need to make use of them in practice. And I just call on the patient organizations, keep up the pressure, work together, and we're your partners. Thank you so much.
Oh, Jan, like always, and like you used us already, incredible some summary of all the stuff that is going on, that is already existing. We just need to use it. We not just need to communicate, to open the channels and to collaborate and to, once again, centralize also where can we find who and what can we do to improve the quality of life of our patients. So once again, right in time, I give over to David Grevic from Slovenia. Let's hear what is going on in Slovenia regarding patient involvement. Welcome, David, and thank you very much for being with us.
Thank you. I'm very honored that I have the opportunity to speak at this very high-level meeting and to share our experience. I will speak about our experience in patient engagement in Alzheimer's disease we have with some international projects. Spominčica was established in 1997. Spominčica is an NGO, a humanitarian organization, with the main goal to help carers and persons with dementia. We are spread throughout Slovenia, and we are also members of Alzheimer Europe, Mediterranean Alzheimer Alliance, and Alzheimer's Disease International. One of our members, Mr. Tomaž Gržinič, is also a member of European Working Group of Persons with Dementia that has 12 members from 12 different countries. Now we find that for the engagement of elderly, especially those with neurological conditions, it is very important to work with their local communities. This is the only way that we also make a friendly society and reduce stigma around some conditions like dementia. We have started with the initiative Dementia Friendly Points, where different organizations apply, and we provide training for their employees from organizations like police stations, libraries, shops, community health centers, homes for elderly, and so on. And the training consists on topics about the dementia, communication with person with dementia, post-diagnostic supports, and right of person with dementia and their caregiver. The members' organization then can provide their services in a friendly and accessible way for persons with dementia and also for other elderly adults living in local community. But their mission is also to share information and knowledge about dementia and to promote the dementia-friendly principles in the community. By this, we also empower several important stakeholders to help people to be able to seek for help, to be aware and to engage themselves in participation in the studies and research, as they are aware of what can be possible nowadays. Moreover, it is very important also to educate professionals so that they are aware and empowered and can therefore engage the patients. Spominčica connects patients, carers, and different professionals, and also formal and informal caregivers, as we are working on empowerment of the multi-sectorial view on the disease, conditions, and problems faced. We hope that the future research will involve multiple sectors and ensure all aspects that influence the person to be taken into account. We can work hard on one segment, but in real life, Several professions are involved in care process, and the research shall interconnect to get proper impact on personal, community, and society level. When we speak of users, patients, and their carers, as experts of their own experience, shall be in the center of the development process for innovation, solution, and also research and trials. The process we use consists of 5 repetitive steps. We listen to people, then we evaluate their stories, also from what is known from literature and experience from our international friends and networks. We then, of course, discover new points of view. We explore new opportunities and work further on the solutions, and again test together with the users, listen to their stories and advice, as they are the only ones who can reflect on their condition and experience. Thus, it is important that we emphasize the person rather only his or her medical condition. As Spominčica, we are included in 6 Erasmus Plus strategic partnership projects and 1 Horizon 2020 project. In previous years, we have successfully finished 3 Erasmus Plus projects, 1 IMI project and 1 AAL project. And we are happy that we are also in 1 strategic partnership project with Alzheimer Portugal. As we have participants from vulnerable group, we need to constantly reflect that this is a complex phenomenon influenced by internal and external factors. And our main focus is on communication and making sure that we understand critical points from all stakeholders. To allow the holistic view of the individual health and other care relevant information so that people can get proper interventions, we need to listen to personal needs. And the awareness that the health and care needs of real people are extremely heterogeneous, even when they have the same condition, is rising. And we are all more and more aware that we need to approach to each participant to ensure his or her proper involvement and maximize benefit for the patient and person. To ensure the proper usage, it is sometimes necessary to provide training and also reduce the stigma of an intervention or of the innovation, so to build trust and to help people to lose their fear. This also goes along with proper ethical approach. We need to be aware of our hypotheses, our inclusion and exclusion criteria, so that they reflect the recruitment of participants that best suit to provide a response to the research question and hypothesis. So thus to include people that also have an experience on the particular issue. Moreover, herein we touch briefly also the informed consent that is often accepted as a necessary paper, but this paper should be carefully communicated to the participants and also shall not be viewed as a one-time only event. This is especially important when speaking with persons with dementia and including them. Finally, we are encouraging also the researchers to reflect on their views on patients and conditions and to examine the possible limitations, stigma, and prejudice about certain conditions and disease. In the following slides, I will briefly show experience from 2 different projects. The first one is IMI project MOPEAT, Models of Patient Engagement for Alzheimer's Disease. And the other one is Horizon 2020 project TENDER, Affective-Based Integrated Care for Better Quality of Life. The MOPEAT project was successfully concluded, And in this project, we were evaluating 4 different methods to engage patients in different timely methods for timely diagnosis. Spominčica was included as the only one patient organization, and we were part of a communication and dissemination work package and very active in this field. So in the project, we were evaluating the efficiency of neuropsychological online tests. The other model was open house, so that the participants can get enrolled to a meeting in a memory clinic. The third one was neuropsychological examination carried out by a general practitioner that invited the identified patients with increased risk for dementia. And the fourth one was neuropsychological test given to patients with type 2 diabetes by a specialist. During the 3 years of the project, more than 2,000 participants across Europe were engaged in these different methods. And what is important is that the whole recruitment process, and not only recruitment, but also follow-up to the patients, was supported with a strong awareness raising campaign named Mind Your Memory, Mind Yourself. This campaign had 3 pillars. The first one were the benefits of timely diagnosis. As we know, there is no cure against Alzheimer's disease or other forms of dementia, but it is important that people know what are the benefits of timely diagnosis, how they can improve their life when they receive diagnosis in time. The other pillar was to differentiate dementia and normal aging. As dementia is not part of the normal aging, cognitive decline is not part of normal aging, but is a consequence of a disease. And the third one was about risk factors. What are the modifiable risk factors, and how can we reduce the risk to develop or cognitive impairment, or reduce the risk of fast progression of these cognitive impairments. And in this campaign, we provide solid basis for successful recruitment and engagement of patients. In TENDER project, Spominčica is in charge of co-creation of the innovative service. TENDER is a Horizon 2020 project where we are developing an ICT-based integrated care model for managing multimorbidities with patients with neurological conditions like Alzheimer's disease and other dementia, Parkinson's disease, or cardiovascular diseases. We have found that there is a fragmentation of services flows, but also on data. Typically, a person's information is fragmented across multiple systems and data repositories, also including several administrative procedures which may cause obstacles for holistic views of the individual health and other care relevant information, so that people can get proper intervention. And people sometimes even don't have information where they can seek for additional help, or are not empowered to explain and their daily stories, problems faced, and they cannot support with everyday data. People are also spending time in different living environments, in different phases of the disease, and the communication among professionals that are in care process can be improved by assistive technologies. So there are several potentials to improve. But more important is that we build this improvement together with people that are facing the challenges in everyday life, as they are the only ones that can reflect on their condition. As I mentioned before, now as we are in the era of building the personalized approach, it is very important that we are aware that health and care needs of real people are extremely heterogeneous, and even when they have same condition. So it is urgent to ensure proper involvement of users and maximize the benefit for them. So for the closing takeaways, services based on new technologies not only transform the patient experience, but also enable organizations to operate more efficiently. In addition, by connecting a large amount of data from individuals from everyday life, they set completely new dimension and new paradigm in the field of research, which we really need in the field of dementia. But in doing so, we must always have the individual, the human being at the forefront, and ensure that the health and social care system is equally accessible to everyone, despite this new paradigm shift. Thank you.
That was awesome, David. Awesome. You really do a great work, and I'm happy to hear that you collaborate with Alzheimer Portugal also. So collaboration, and together we are stronger. André, now it's your time, please.
Hello. Hello, everyone. My name is André Valente. I work at the Champalimaud Foundation, and namely in several projects where we actually fully partner, not just include patient organizations. And I have to say that from our experience, this has made the research much better and is making, as we speak, the consequences of that research also better and certainly faster, getting to the patients. So we're moderating now. I'm moderating now discussion on what is this roadmap for patient engagement. What can it be in Europe? Following Bettina, Jan's, and David's interventions. But I think, first of all, we should kind of focus on the many questions we've had. We've saved some from the first session, and I think that's where we should go. So one question, Bettina, you mentioned this, Jan, you mentioned this, David, in your projects. You also illustrate this in some ways, but it repeatedly comes up, which is, how is it that we find partners? How is it that we get to the researchers? There was a questionnaire presented also on the previous session that showed the organizations that were involved in research and those that were not. And many just said they were not because nobody had called them. So how can you take a more active attitude, and how do you do it differently? Bettina, would you like to start?
That's actually a really mean question. Because I think a lot of the stuff where we have been involved is like was coincidence or luck, or I don't know how you want to call it. So I actually think that my advice will be that it is very, very hard to say this is exactly what I want and go directly with this narrow focus in there. I believe that starting with like assuming a greater visibility in your research area and being easier to be found is a good first step, because then you make these coincidences just more likely to happen. So for example, what one can do is one can attend scientific congresses. We do this with our patient organization, with a group of people. We get together. We have contacted, so we have some, because I'm in melanoma, we have melanoma specific conferences, and we have a great collaboration with the organization. So that would be EADO. And we always get a free registration to the conference. They support us with rooms, and we often have an official exchange. And I think that's a very, very good first way that people get to know you and you get to talk to them. And I think often even on the research side, projects happen that way, like organically. You have an interesting call, a topic you find interesting, you find people who kind of, are interested. So I think making chance more likely, exposing yourself and starting somewhere. But there is no magic cooking recipe how you can start today and end up on a project tomorrow.
The several tools and programs you spoke about, Jan, do they also provide these connections? And Jan and Bettina as well, because Bettina, you're in a network. How is it that you, and this is something that has also come up, the barrier of language? How is it that in countries such as Portugal and Slovenia, right? You don't speak, some people don't speak well English, yet they're very informed, very well connected, and have a lot of energy. How do you do this in your organizations?
Well, I think every community has a different approach because the communities work differently and the diseases are different. In my community, we have the privilege in the meantime to have very good survival. So we have advocates which have been around for a very long time. So they're usually very experienced. And that's, let's say, that's where we started to engage on a very structured way, because the first thing that is always important, you can't get that out of tools, is building trust. Building trust that on one hand, you trust yourself that you can bring an important point into research, and on the other hand, that they trust you, that you're not there to cause trouble, you're there to be a productive partner in the research that they're planning. And I think so trust is the first thing. I mean, we've then started to run community advisory boards, and the way we've composed it to have people from different regions, from all world regions in there with different competencies, some really experienced on access, but not very experienced on research, and some very experienced on research, but not so experienced on access because it's not an issue so much in their country. And I think that complementarity was always fantastic because you had people with different professional backgrounds, different regions and different interests. And then, of course, systematic training for everyone, that you can actually have meetings with research groups or with industry researchers or whatever to discuss these things. The tools that I've noted are just supporting that. They're giving a frame, they're giving a structure. They start to help you speak in the language of the other party, because that's the way they operate. That's the way they set up clinical trials. So you can really discuss about the stuff that matters. But I would say trust is the first thing, knowing the tools as well, and the right knowledge that you're competent to discuss with them is very important. I can tell you that's been taking some years for me. I mean, when I was going to the first medical conferences, I didn't understand what they were presenting, but every time a bit more. And today, it's no problem for me to discuss about any kind of CML study because I understand it, but it's been a bit of a painful way, but you need to be ready to learn.
David, from the projects you mentioned, how did they start? How did your organization get?
Yes, fortunately, now more than any time before, it is getting more and more important to engage patients in the development and to build the solution or product or research with co-creation. So this gives us an advantage in that we are, patient associations are wanted partners in a way. But yes, how to start with this? We here at Spomenčica have the luck, maybe we can say, that we, in all our activities, we engage different professionals from medical research, from social research, even from basic research, to present their work in our Alzheimer cafes, because we have found from the beginning that it's important to make this multi-sectorial interconnected approach to bring all the experts together, because it's important that the experts speak between themselves also and speak with the patient association, but also different sectors of experts speak between themselves. We are also organizing conferences here in Slovenia where we bring together not only experts from different fields, but invite patients and carers to meet with the experts and speak with them, so that these experts get a real insight in everyday life and problems of people, of the disease they are exploring. But another thing that is important is that once you start building these connections, then you slowly build the network. And similarly, it is, for example, if you are included in a European network like Alzheimer Europe, you develop this wide network of organization, and when you meet, you come closer and build trust within the community. And when you are, firstly, we were invited in a project, and in doing so, when you build this trust with the work you are doing, then you get the reference and you are invited in another project, and then you prepare a project and invite others. So it is important to start the process, to start with small steps, to go to the experts and scientists you may know or may not know, and to present themselves. Who are you? What are you doing? And invite them in your activities, maybe to listen to something and to get slowly involved. And then step by step, building this network of collaboration.
Thank you so much, David. Before we start also discussing here from several questions, how to create the incentives on the roadmap and to get to the roadmap for these things to happen, maybe Elsa Mateus would like just to comment, since we've had many messages on some of the activities that you have, and also Joana Viveiro, I believe she's here as well from Plataforma Estudantil. For those that don't know them, they both had the European Patients Academy in Portugal, and a platform called in Portuguese, Platform Health in Dialogue, which aggregates a lot of organizations. Elsa.
Okay, I think the roadmap has become very important for even for patients and patient representatives and patient organizations, and for researchers. I believe the main issue still remains that sometimes it's not easy to find a way to get into the roadmap. As we can see, even in our chat here in this session, the same as it was in the session, the Portuguese session, there's still a lot of questions how to match researchers and patient organizations, and how to find. We have these, we all know how, we have the map, we know the path, we know where to go, but we still don't know where to find each other to relate and to establish the partnership. I think this is now also a main issue, and we need to think how to solve this and how to put people in contact so they can build their partnerships and bring the added value to the research. That would be my comment.
Joana, would you like to comment and comment?
Okay. Well, are you hear me? Okay.
We can.
Yes. Okay. Well, I'm Joana from Portuguese Health in Dialogue platform. We are a non-profit private institution that congregates around 50 patient associations and also promoters and the healthcare users. We have more than 20 years of existence, and we defend this kind of integration and dialogue with patients and also professionals and researchers to make this kind of integration in the research more effective. I think this meeting is important because it's important to think on a way to implement this kind of involvement of patient representatives as partners in research, and to providing these good examples of good practices, European practice and national practice, that allows to reflect the possibilities and the needs that will enable this involvement for patients and researchers and all other stakeholders.
So one interesting thing, and a question for Bettina and Jan, who's been very involved in this European roadmap. We're getting questions from researchers on how to do this. So is this a road? This is not a roadmap for patients, right? This is a roadmap for Europe about patient involvement. Can you tell us about how a roadmap like this can put the incentives in place and really help everyone do better science? Bettina, you stressed this a lot, the idea of better science.
Yeah. I mean, that's the reason why we do it, right? I mean, I think there are two parts in there why patients should be involved in research. The one part is the transparency and accountability. There is a lot of, we do this in patient interest, and in the end, it's taxpayer money, and we're taxpayers. So I think that is the right way to go, that we're transparent about how tax money is spent. And that's not just for patients, that's for everyone in society. So that's one side. That's the part I'm not particularly passionate about, because in a way, I think that is responsibility of the funders to keep everyone honest and to go chasing, and also of the researchers to, for example, make their science accessible. And they're fantastic. I mean, there's the Night of Science. Maybe I'm just a nerd, but there's the Night of Science. There is Have a Pint of Science was just in May. So they're really nice. Right now is the innovation, is the Research and Innovation Days of Europe right now. I mean, there's fantastic, I don't know, scenes, ways to interact that are just pleasure to listen to, where you get to hear about stuff you would have never considered. I think that's a way. I think that's a good way to spend an evening, but maybe, as I said, maybe that's a bit nerdy. So I think that is a side on the responsibility of the researcher. I personally, as a patient advocate, I try to spend as little time as possible in that space, because in a way, it feels a bit like, being the parking attendant going around and checking for people, whether they have parked their car in the right space. You go after people, you hold them accountable. It's negative if something has gone wrong. And the worst thing it's too late. The money has spent, the time has passed, we haven't made progress. And it's just like, counting after the fact. The much more positive side is to think about, what can I do to contribute that research gets as good as we can just humanly make it? And that's actually something everyone wants. I've never met, the years I spent in research, I have never met a single colleague who gets up in the morning and says, today I'm going to do something totally meaningless. No one does that. We all have this ambition to contribute, to do something with our lives, to be the one who discovers something that has impact, that changes lives, that gets recognized. That's what drives research, right? So I think it's about us. How do we get there? How can we be the facilitators? How do we make this magic happen? There are lots of questions. So how do I find patient organizations like that? Honestly, folks, train research to use this search engine. It's called Google. I mean, I've been reviewing grants this year, large numbers of them. There are lots of grants that say there is no patient organization. All I do is I stuff the disease into Google and Google for a patient organization and find 5. There is no excuse for that level of lack of diligence. So honestly, frankly, so that's the first thing. I'm really upset about it, because that's just a simple lie. It means they even haven't Googled for a patient organization. So that's one thing. And then after that, I do believe I really like David's suggestions to invite people. We do a similar, just like for our own field, because, you know, I first think it is very important to make this interaction happen on a space that is defined by the patient community. Because just think about it the other way around. Imagine you're a single patient, you've never been exposed to a research setting. You get invited to a meeting. Usually these are these auditoriums, a room full of people you don't know. It's quite intimidating. If you've never been there, that's not really conducive to a real exchange, to a good discussion, to be honest. So I think if you twist this, if you go to a patient event, it's the patients organizing it, it's the researcher who goes on their turf. And you can talk to one person, to two, to five. You can make up your own mind. And I think that is exactly as David said, also a way to put different stakeholders together and make this magic happen. And I think that's a space that we as patient organizations should actually actively think about and consider. Because I think that's where a lot of projects have come out also from for us in melanoma, people who met at our meetings. So I think that's another piece where we shouldn't undervalue what we can actually do, contribute. We are usually good at networking. We know lots of people. We also get together because it's good to meet people who understand what we're really going through. So I think we should be building on that, and that facilitates research. For the research institutions, for looking for people, and I know that people here have different opinions. I don't believe in databases. Well, my husband was a database administrator. That type of database, yeah, I get the point. But that was for a bank. We're not a bank. The databases are as good as the content we have in them. And I don't think you get this feeling of a patient or what a patient experience like from a list in a database. You know, I think talking to a person and getting like this visceral feeling, what it is like to live with that condition, I think is very hard to capture in words, let alone in a database. I know that people want it easy and want to maybe avoid this personal contact because it is taxing. I mean, going to somewhere, I'm in cancer, I know what our community looks like. I've been working now with Duchenne colleagues. Going there taxes you because listening to these stories and exposing yourself to that type of suffering takes a toll on you also personally. But I think that is what makes the research good. And then I stop talking. So I just don't think we can easily code it. I think the value is often in this personal approach to a problem, getting a real feel for the suffering of the community and the way the community thinks. And that you just have to move yourself there. Have a beer with them will get you more than a database.
Thank you, Bettina. We are coming to a close. I would just like to make a final question here to Jan and also David. So we are now in a situation which is considering the past, a fortunate situation where we've had a declaration signed by the 3 countries that will set the political agenda of the European Union, and a declaration that we have a lot to thank for, in the sense that it really includes patient engagement, not just as like a little involvement, but fully in the full translational cycle of research. So how do we all, patient communities, researchers, work together to make sure that what is on paper, where there's already been a political will shown, is going to take place? I'd like to hear from you, Jan. I know you just talked about the roadmap. And then David, without wanting to give you the whole responsibility, to think about what can we also do in Slovenia in the next 6 months to kind of take this work further. And then we will step to the closing session. We don't have much time, unfortunately.
I mean, one of the things is actually what you've done, Andre and Tamara and everyone else, is actually bringing people together, because you need to keep the topic on the agenda and ask and make suggestions. I mean, what doesn't work is, let's say should advocacy, where we all sit in our rooms, talk amongst each other and just say they should all do that, they're all damn stupid because they don't do it. Of course, they have a million priorities. How do you make sure that the priority on, let's say, patient engagement and battling cancer and so on stays on top of their agendas? It is because you do meetings like today. It is because you join forces across disease areas, across patient organizations, across stakeholder groups. And then think about the interest slide that I showed earlier on. Think about what is the interest of the other parties to do so. What is the interest of the Slovenian and Portuguese politicians to keep that on the agenda? Why should they do that? Why? What can you contribute? What's your suggestion? I mean, I frequently just send a suggestion and don't dare to ask. So how could we do that? Could we bring a workshop together? Can we discuss this? I'd volunteer to help you on that. I can bring 10 people who know what that is. You bring 10, I bring 10, and we discuss about a specific topic, and that's the intended outcome. Do these kind of things, and that's what Bettina is doing in the Cancer Mission. That's what I'm doing in other places. We're trying to make suggestions all the time and give offers that people can take and actually have a hard time rejecting in the public and say, I'm not interested, my priorities are elsewhere. That's why I think you've done a very important move with this meeting today, because you keep it on the agenda and you invite the next presidency to say, so when the Portuguese presidency is over, Slovenia, what are you going to do next? And that's brilliant. That's how it should be.
Thank you, Jan. David, what do you think about this and continuing this in Slovenia? How do you see the panorama in your country, both taking this forward in the European agenda and nationally?
Yes, I fully agree with what Jan and Bettina have already said. It is important. We must realize also about the TWI as patient organization have a lot of power. A lot of power that we can use because we are representing real persons and patients and their carers. As NGOs, also we have a lot of power to speak in different way to the politicians like other interest groups. And we are in the position in speaking like a civil society. And our voice, we must realize that our voice is strong. And we must continue to work to keep this political will active. And events like this one today, I believe that should be carried continuously also through not only Slovenian but also the next one, French and so on presidency, to show ourselves, our motivation and engagement, and also our work and experience. So I'm welcoming your offer to continue with this work. And you also know a lot of colleagues, other colleagues here in Slovenia that are active in this field, in advocacy and empowerment. So thank you and welcome at the same time. You're muted, Andre.
Sorry. Thank you very much, David. I would just like to acknowledge that there's still many questions that have not been answered. And that is indeed a clear sign that we should continue this sort of events and we should continue this sort of interactions. There are actually many questions. There's a question from Tiago Alfaro from the Coimbra University Hospital. There's a question from Emma Doris from University College Dublin in Ireland. And so these are questions also from research institutes on how everyone can work together. And the plan is indeed to have more work together. I will see if I have a little bit of time just to show you a little bit about what the organizers thought about, but I think we should move quickly to the closing statements. We really have the pleasure of having here with us Matthias von Wirch from the German Federal Ministry of Education and Scientific Research. And we know, Matthias, I've never met you, but many of us have heard a lot about you and your work without knowing you. And I would like to thank you for that. And we are very, very grateful to hear you here and that you made the time specially to be here. Thank you.
Thank you. Yes, it's a great honor and pleasure for me to be here. I hope you can hear me because even though I come from punctual Germany, I missed the sound check. But I see by Bettina's reaction, okay, great, you hear me, that's fine. So it's a pleasure for me to be here. And that pleasure is really twofold because first I have defeated my ministry's barriers on the IT level of using Zoom conferences. So that's one big plus. And the other pleasure derives from the fact that I was deeply involved in the Berlin Declaration, in the process that led up to the signing of this Berlin Declaration that has been mentioned, and also in the process that came afterwards. And that's the collection, the bottom-up collection of these principles that many of you have already mentioned. I love this principles paper. Jan has already shown the slide with the link to the feedback process that is right now in progress. It will be open until the end of this week. So please feel free and use this link that Jan has shown you and leave your comments. It can only become even more better, this paper, the principles, and we hope that there will be much use coming from it. So regarding the principles, I must say all I've heard here is somehow in there. There's the question of mutual trust that is necessary for involvement. There's also the question of knowledge and training that Jan has mentioned. That's in there. And for us funders, there's a very important aspect in there, and that is that meaningful involvement can only happen if sufficient time, financial resources, and flexibility are invested. It can't happen without that. That for me as a funder is very, very important. So we have these principles, they're on the table. And for me now it's time for the big question, what happens next? It has been discussed here already, but I think it's a very valid question to ask. And in order to try to provide an answer, I have to come back to something Jan Geisler has said. He said that frameworks or mindsets only change if the policy side supports this change. Now, from my point of view from the ministry, this argument can also be turned around. I strongly believe that our influence and our outreach on the policy level can only go to a certain point. This initiative, the Principles Initiative, will only be successful if we succeed in motivating our local, regional, and national scientific patient advocacy and healthcare organizations to translate what was gathered into concrete action on their level. I don't think it can happen without that. Now, that having been said, in Germany, we have supported this for a long time, mainly by making it a prerequisite for our funding and by providing the means that are necessary to actually do this in research. And we feel that these efforts, together with those of many other players in Germany, are showing some effect. The atmosphere is slowly changing in Germany towards a more open attitude regarding involvement in research. And actually, many of our scientific organizations have taken this up. They are adopting policies of their own for more involvement within their own walls. An example is our German Cancer Research Center, or DKFZ in Heidelberg. They have just recently installed a permanent patient advisory board for their activities. And there are several other examples, which I won't give you now because of a matter of time. Well, I'd like to close by really, after these examples from Germany, by expressing my deepest hope that our initiative for successful patient involvement in cancer research and the principles that were gathered bottom up by over 130 participants so far in this process will bear many more fruits, not only in Portugal and Slovenia as the two countries that have actually signed the declaration with us, stating that this is important, but even beyond in other European countries. And we as a ministry, of course, are certain that more involvement in research will definitely translate into more meaningful research with added benefits for those at its focus and even other stakeholders as well, of course. And this alone is enough motivation for us to continue, and it should be enough motivation for others to actually take concrete action. And well, my ministry will continue to play its part in networking and exchange both within Germany and also outside Germany to keep on supporting this. Thank you very much.
Thank you very much, Matthias, for your contribution and for being here today, and for your work and being precursors of this work. I should say that the Minister of Science, the Portuguese Minister of Science, Higher Education and Technology, actually will not be making the closing. He made the opening. And he made sure he was at the opening session with all the Portuguese organizations and gave strong words in support of this work. With us, we have Teresa Tavares. I don't know if Teresa is live here. She might not be. Do we see Teresa Tavares?
Yes.
Yeah.
Yes. Are
Needs
you?
to turn on the microphone?
Yes,
Okay.
I am. Hello, Andre. Yes, I am. Thank you.
I should say Teresa is international advisor to the Minister of Science, and has spoken with several of us. I was introduced to Teresa by a patient organization, even though I am from a research organization, and we'd like to thank you to also be here, complementing the presence of the minister. Would you like to just tell us a few words about this work?
Just very briefly, because obviously my minister has already conducted his participation. I just want to say that I've been following the event since the beginning, and I'm really thrilled for all the presentations that have been presented. And I'm definitely even more determined on behalf of the ministry to push even further all these the different aspects of patient involvement and patient participation in this, what we consider to be the full translational cycle from research to patient care and disease prevention. So making sure that the patient is really at the center of these, what we call shared decision making. I believe some of you have already been together with us during the event that we've organized on the 3rd of May on the European Cancer Research Summit that we've organized together with IPO in Porto. And I also, as already been mentioned, patient involvement and patient participation was fully acknowledged and supported throughout that conference, and throughout also the declaration that is what we can call the summing up of one of our major priorities from the Portuguese presidency involving cancer research. The declaration, the Porto Declaration on cancer research, is open for signature and for endorsement of entities and citizens at large. And we already have over hundreds of endorsements throughout Portugal, but also throughout Europe. And I just want to highlight that, and to ask also all of you to, if you're not aware of the declaration, to please also read it, and if you would like also to endorse it, because we really made sure that patient is at the heart of what we to be a full continuum of research throughout Europe on cancer. And our aim and our hope is really to achieve by 2030 a 10-year cancer-specific survival for 75% of patients diagnosed in EU member states. So for that to happen, we really need to count with the support of everyone, from researchers to doctors to associations of patients, and so that we all together can really be mobilized for these cancer-specific survival for 75% of diagnosed in the EU. So thank you so much, and thank you so much for the organizers of this wonderful event. I really hope that I really wish that it can be web streamed across Europe, so that more people can listen to all these very inspiring words from everyone. So thank you again on behalf of the ministry.
Thank you very much, Teresa. On behalf of the organization, I should just say that we plan to actually publish conclusions, take the questions that have been asked, and also move this conference forward. You, as you are all familiar with the conference and what we and the face of the conference, we tried to make it, and this is just going forward and answering many of your questions as well. We tried to make this conference in 2 sessions. One that would work nationally and would bring together the Portuguese associations around a very complete questionnaire and around positive, good examples of things that are already working and working very well in Portugal that we can all emulate in Portugal and elsewhere. So we made the meeting in Portuguese and in English and in Portuguese. There were these participants and the round table here on the examples. Some of you were not here in the morning. It was really lively with lots of. It was a very positive surprise, and then this session that we just had now. The plan now, and that's the challenge, is to take this model and continue it on. Everyone seems to want to do this. Jan stressed this, and now we even have a face. We can add Slovenian, and we can, these hybrid national international models seems to be working well. We will also write about it in the conclusions, and many research institutions also want to participate, to learn more about this. The learning doesn't only need to happen on the patient side, it needs to happen on all sides. Patients, researchers, healthcare practitioners, and policymakers. Thank you so much, everyone, for being here, for taking your time, and we will be in touch. Thank you especially all the Portuguese associations that worked together to really make this happen. Thank you.